Hi, everyone. Welcome to ChiroCast, the show where chiropractic insight meets everyday impact. I'm Dr. Stephanie Brown, and today we're diving into a topic that's becoming increasingly popular among chiropractors, and that would be dry needling. So whether you're certified or just curious if it might be a right fit for your office, you are in for a real treat today. We are being joined by Dr. Aaron Wiegand, president of ChiroNeedle and a leading voice in the dry needling space. We will explore what dry needling is. I'm going to be honest, I don't even know what it is, so we're going to find out, and what it isn't. Clinical and business benefits, and how technology like ChiroTouch helps streamline your workflow when offering new services like this. So let's hop in. Dr. Aaron Wiegand, welcome.
Hi, Dr. Stephanie.
Yeah, so glad you could join us today. I really appreciate it. So could you just start telling us a little bit about yourself and how you got into dry needling?
Yes. So I'm Dr. Aaron Wiegand. I practice in Phoenix, Arizona. I went to Palmer West and graduated there about 18 years ago. Been in practice since then, and do a lot of PI work now in my practice. But got into dry needling, the same way a lot of chiropractors find therapies for themselves. Is that I was injured. I had a 13 millimeter disc extrusion in my low back. At the time, didn't know what it was, but knew I was in pain and knew I had to see patients, had to figure it out. Went to a physical therapist office that was in my building, and they used dry needling, pulled out this 100 millimeter needle. I mean, it was literally about that big, and said,
Whoa.
well, we're going to stick this in your glute med, and then we're going to stim it. And I'm like, whatever, I just need to get to work. I got rent. Just like most chiropractors, we got bills to pay. We can't take a day off. So, and I felt, 70% better, and I was super relieved. And then kind of upset. I didn't even know what this was. And yet this PT who's fresh out of school was doing this amazing thing that helped me a lot. And I was like, well, how come I can't do this for my patients? So I took the next 4 years or so and started studying with PTs, learning everything I could about dry needling and integrating it into my office, and then eventually bringing it into my personal injury practice. And during COVID, just like everybody else, trying to find something to keep busy, developed ChiroNeedle to share this with the rest of the profession, and hopefully use it as a conduit to then help their patients find relief as well.
Okay, cool. So we have two directions we can go here, but first thing I want to ask is, what is ChiroNeedle?
ChiroNeedle, right? So ChiroNeedle is the company I created, and really started off as just creating a class for dry needling. I wanted to create the class for chiropractors. I had been spending hours and hours, over 100 hours of dry needling classes in physical therapy settings. And while there are many, many, many similarities, and I learned a lot from them, the pace of patient care is simply different in a chiropractic setting, and the population and the types of cases that we see. And also the abilities chiropractors have to integrate dry needling in a combination therewith. We call a multimodal care plan, is just different. And so I decided to create a curriculum the way I would have liked to have seen it from a chiropractic perspective, integrating also the what do you do after dry needling? How do you integrate it with the adjustments? What kind of rehab and therapy do the conditions that dry needling treat demand, and what works best? So I put that together as a class, just almost as a personal pet project.
Mm-hmm.
And then people started signing up for the class, and we started doing that. And it just grew from there. We started in Phoenix, Arizona, and then we started going to Austin and Houston and Dallas and Flagstaff and Tucson, and just getting chiropractors together and having a good old-fashioned technique class where we get together. And unlike other seminars where you mostly just sit and just either learn more about how what you're doing is already working, or learning why some machine that you're buying is working. This is something you're going to get in with your friends, with your chiropractic colleagues, and use your hands and learn a new skill set. So it just became so much fun. And now 4 or 5 years later, we're teaching almost every month.
Okay. Awesome. I like it. So that brings us back to probably something more important, and that would be in general, just what is dry needling? So kind of have to have an understanding of that first, I think, to decide if you want to do that. So,
right.
And I will share with you personally, I see an acupuncturist it varies, but maybe 4 to 8 weeks on or off, and what have you. But so what is dry needling, and how might it be different from other modalities that use needles?
Sure. That's a great question. I'm so glad you brought that up, Dr. Stephanie. I so uh, let's just start with the origins of dry needling. So Travell and Simmons doing trigger point injections. Well, they're injecting these things into trigger points, seeing what works, what doesn't work, and then they want to see what the placebo effect or what the other effects of the needle and just injecting saline, what effects did those have? And first they started with saline. They found, well, that worked pretty effective. And then they said, okay, what if we don't inject anything? And they found that was effective.
Hmm.
Obviously, that led to us using trigger point injections now, but people kind of went back, some physical therapists went back and looked at the literature and said, well, the needle worked pretty good just by itself. On top of that, we had pain management specialists doing the same thing with their with injections, using trigger point injections as well as epidurals, and using just the needle to see what was the placebo effect. And what they found is the needle in of itself was highly therapeutic. And physical therapists kind of like found this, put it to use, and lo and behold, we have the advent of dry needling. However, this happened in my practice. I started with dry needling, and my patients started asking for acupuncture. I didn't know. I had to be honest. I said, I don't know really, much about acupuncture. And they thought, well, you have these needles. Why can't you just do this thing? And I said,
Yeah, right.
I
That's what I'm wondering.
I felt so out of my element. I said, I don't know. So I said, you know what? I'm going to go get some acupuncture, learn a little bit more. It was wildly difficult to get acupuncture, setting an appointment, when they're available, and all they can do is acupuncture.
Mm-hmm.
And I said, well, I went and got acupuncture and I felt better. I really enjoyed it. I said, but what if that acupuncturist was able to adjust and do rehab and do all these other things that the patient would need after their acupuncture section? So immediately I went and got my acupuncture certification as well. And now I integrate traditional chiropractic, rehab, dry needling, and acupuncture in my practice. But they are two completely distinct things. They just happen to use the same tool.
Okay, interesting. So is the approach to how you would place the needle different than how an acupuncturist may decide where they're placing their needles? Does
Well,
that
just
make
like in
sense?
chiropractic, it does. Just like in chiropractic, in acupuncture, they do it a lot of different ways. Traditionally, the needles only go in so far, usually about 15 millimeters, maybe 25 millimeters. And they're trying to stimulate meridians or neural points to help the general health of the body. It's not just musculoskeletal conditions. In acupuncture, you're trying to balance this kind of energy and or the autonomic nervous system in order for better health of everything.
Mm-hmm.
Dry needling is pretty confined to the musculoskeletal system, and it goes much, much deeper traditionally. There are acupuncturists doing something called deep acupuncture, where they do go deeper. This has been as of late, and they're even publishing on it. But dry needling often goes down to the bone level. I mean, you're pecking the periosteum, you're in tendons, you're in ligaments.
Wow, so
It's
it
much
really
more
goes
soft
that
tissue.
deep.
It does. It does.
Sometimes. Got it.
Yeah, it can. There's some techniques called periosteal pecking, where you're actually going to kind of poke holes in the periosteum so you create a bleeding effect and therefore get more fibrinogen so you can create a scar tissue or heal certain things like tendons, especially lateral epicondylitis, supraspinatus tears, things like that. So I always call it like kind of a poor man's PRP. There's lots of research on this. It's highly effective and it's competitive with those oftentimes higher risk and higher cost modalities such as trigger point injections, PRP, Botox. There's literature out there comparing dry needling, and it is considerably much safer and much less expensive. And you're getting it done by a chiropractor who can also then immediately adjust and give you rehab. I always say this. As a chiropractor, you start young and you don't know what real pain is. And then you get older and you realize you really appreciate what you're doing for your patients. Am I right?
Yeah, I'm going through that this week, actually.
You see your patients and you're like, you get your first bout of real back pain. And you're like, is this what I've been helping the whole time? I really need to charge more because I am a miracle worker. You really don't appreciate yourself until you have the pain. Yeah. And, with 13 millimeter disc extrusion, even though I had to have a microdiscectomy, these things flare up. And and sometimes I need an epidural. But the sad part is I go to get an epidural and that's it. There's no one there to immediately put me on decompression therapy or do dry needling and some stim on the glute muscles to help or do any kind of rehab or, God forbid, adjust. I would have to go to a pain management specialist, then make an appointment to a chiropractor to get the adjustment and decompression. And oftentimes, because many chiropractors don't do rehab, then go find a physical therapist that's going to put me through rehab. It would take me 4 appointments. Mm-hmm. I'm here to tell the chiropractic profession, guys, we could totally dominate the pain management space and conservative care by being able to place the needle in a strategic way that's competitive with a lot of what pain management does, and then do your chiropractic thing of adjustments, especially in the low back and neck, decompression. And then if you have a basic understanding of functional rehab, man, you are competitive. You're basically taking the place of 5 doctors at once, much more convenient, much lower cost, much lower risk, much more effective than what anything else anybody has out there. So that's what I'm out here to tell you. It's not just about the needle. It's about how the needle makes you a completely different chiropractor.
Got it. Okay, that's cool. Um, can you think of any like myths or misconceptions that you've heard that people might have about dry needling and or how it might apply within the chiropractic profession?
Ooh, that is a lengthy one. All right, well, let's try to summarize it here pretty quickly.
Myths or
Oftentimes people,
misconceptions?
myths and misconceptions. One, let's do with a myth. I love myths. So let's dispel some myths. The one myth is that it's just rebranded acupuncture. It
Okay.
isn't. I've done both. I've gone through both. Eastern medicine is an elegant philosophy and technique. It is completely different than dry needling. Um, as far as, is it extremely painful? Believe it or not, here's the thing about needles. The length doesn't really dictate the pain. It's the gauge, right?
Okay.
The gauge of the needle, a bit, if the needle is as thick as a nail, but it's only 15 millimeters, I would rather have a 100 millimeter long needle that's as thin as hair.
Yeah.
That's where the pain comes from. The length, people go, oh, it's too long. The length doesn't matter. Now, the other thing is that people say it's extremely painful. Well, just like going to different chiropractic schools, there's different schools of dry needling. And I have been to a myriad of practitioners. And just like when you look, as chiropractors, we go get sample adjustments from each other all the time. And we're not all the same. And there's different strokes for different folks. And you're going to find people who needle in a way that you like and needle in other ways that you don't. Some people are just trigger point dry needlers. They go in there and they just try to aerate the meat. I call it meat tenderization technique. That's okay. Others are more subtle and try to work more with the nervous system, and that's a lot what I teach. So is it really painful? No. Is it rebranded acupuncture? Absolutely not. Is it within the philosophy of chiropractic? Absolutely. And I'd like to take just a minute to explain why.
Yes, that
Without
was
going
going
on
to
a
be where I wanted to go next. Let's do it.
Okay. I'm a second generation chiropractor. And while, it's easy to label me as a heretic for mixing, my father and I, if you're in a chiropractic family, Christmas is always fun. But so here's what we know. If you're a chiropractor and you are all about the mind-body connection, you're a holistic chiropractor. Then it means you believe that the mind and the body, they work together and they are integral in overall health. Well, if that's true, then we also know that pain is bad for your health. We know it's bad for your mental health. It makes you antisocial, it makes you lose empathy, it makes you more prone to anxiety and depression. And we also know pain is bad for your general health. I've taken many, many hours of class with Dan Murphy. And if you've ever spent any time with Dan Murphy, if you take away anything, you should know that nociception leads to increased sympathetic tone. Increased sympathetic tone means increased stress response, and your immune system and every other system goes in the dumper. If you're going to sum up, that model of health. So what I'm here to say is pain management is health management. Being in pain is bad for your health. And we're going to have a whole lot of people, especially with the boomer population, who are going to be in chronic joint pain. And let me tell you, folks, there are not a lot of good options out there. I work in pain management. Right now, I work in a multidisciplinary pain management clinic where we do epidurals, we do radiofrequency ablations, we do Botox, we do PRP, we do spinal implants. We do everything under the sun, and we're grabbing at straws, especially since we can't use opiates like we used to. Thank God.
Yeah, bad.
The options aren't great. So if you can find a way to provide drug-free pain relief and neurological calming, especially to people who have chronic pain, that neurogenic, centrally mediated pain, man, no one else is doing that. And we could be a big asset to the population and their health by being that pain doctor that they need.
Yeah, I think it's important too that then they can be doing that in the setting of a chiropractic office, which is going to come along with, it certainly depends on the chiropractor, but it's going to come along with that approach to health versus maybe, outside in approach to health, perhaps. So I do think that there's a benefit for the patient if they have options like this with practitioners like us who kind of have a different approach than Western medicine does to most healthcare.
For sure, for sure. Physical medicine is in a lot of need. It's going to be in more and more need. And pain, again, it makes your psychology bad. It makes your digestion go to pot, your immune system. And you know what? It's hard to exercise if your joints hurt. I mean, if you were to pick something just to tell someone to be healthier, according to literature, it would be eat more plants and move more than you did before.
Mm-hmm.
So you can't move. You can't move a lot if you're in pain. So, learning how to exercise, it's hard to do when you're in pain. It's hard to meditate when you're in pain. We know meditation is good for your health and mental health. And also, if you're stressed out all the time, that cortisone, it makes you crave different foods. How many of us have been stressed out? Do you crave a salad? No. No, you want
Not
a big,
usually.
fat, greasy burger when you're stressed out.
Yeah.
So it's real hard to be healthy and in pain. And if you can help people with their aging joints get some relief and get back to an active lifestyle, you are a health and wellness practitioner.
Yep. All right, cool. Okay, so give us an idea here. In your experience, what kind of conditions can dry needling either treat, resolve, help, improve quality of life, all those things?
Well, let's start with the literature. If you look up, there's over 1,000 dry needling articles in PubMed.
Mm-hmm.
There's another, I believe, over 10,000 PubMed articles on acupuncture. So, I always say the human body doesn't know what letters are after your name. Needles are therapeutic. So on what conditions? Well, most basic, we know shoulder pain, shoulder tears, impingement syndrome, really effective. Plantar fasciitis, very effective. Osteoarthritis of the knee, effective. Headaches, TMJ. Guys, TMJ is a horrible condition. No one knows how to treat it. If you can do that, you're moving mountains. Lateral medial epicondylitis. Research recently on the carpal tunnel where they actually can show the needle going into the flexor retinaculum and changing the thickness of the retinaculum by manipulating the soft tissue inside. Perineural needling. That's where you put needles close to the nerves and stim them so that they can heal with things like neuropraxis, or we've all had those brachial plexus kind of conditions after car accidents. Look, everything that walks in your office and more. Back
Got
pain,
it.
neck pain, shoulder pain. It's going to expedite the process. It's going to get that healing process happening faster.
Got it. Also, this is going to be a two-part question too, because I love to do that.
Yeah.
Do you know why it's called dry needling?
Oh, excellent question.
I don't know what wet needling is. What's dry?
Right.
Why is it called dry needling?
It's called dry needling because at the beginning, when Terrell and Simmons were doing this, it was just sticking a hypodermic needle in with nothing in it. So it was a quote unquote dry needle. Understood.
Okay, that makes sense. Got it. I'm happy that there's an answer to that too, though.
Me too, and I'm glad that I know it. Otherwise, that'd be really awkward right now.
Yes. Okay, good. We don't need to go there. Perfect. Okay, so then part two to that, though, is you've mentioned, though, attaching stim and doing stim to it. So obviously, it's still dry needling, but how does that add to it when you add stim? Can you get into that a little?
Sure. Look, everything we do in our practice is pain gating, right? We're fighting the battle. There's mechanoreception versus nociception. Mm-hmm. And at the spinal cord, there's a fight to see who gets to make it to the brain. And so when you move more, that's more mechanoreception and less nociception. If you have more inflammation, that's going to be more nociception against the mechanoreception. So, if you stick in, so for example, when we adjust somebody, their joint moves more, that's more mechanoreception, that's a win. If you put a needle into a muscle or a tendon or a ligament, there's a lot of mechanoreceptors in there. There's a ton of them. And if you put them, especially like suboccipital muscles or these muscles that are highly innervated, mm-hmm. and then you add stim to the situation, it's like the difference between if you just put a little needle in 15 millimeters, that's like a flashlight. Mm-hmm. If you put a long 100 millimeter needle in, touching all those mechanoreceptors, and then you add some stimulation to that, man, it's like a lighthouse. Just, I always tell people, if you're my generation, you remember something called the Care Bear stare. It's like the Care Bear stare of mechanoreception. You put a needle, you put needles into muscles all along the nerves, and you turn on some electricity, man. It's just like of that mechanoreception going up against that nociception. And for our patients suffering from chronic pain, where there isn't that pain generator that we can actually heal, that their nervous system's kind of misinterpreting the sensation,
Mm-hmm.
man, to be able to kind of hack the nervous system and send that mechanoreception in to fight that nociception without having to move them all that much. These are patients that they don't do very well with manual adjusting, and they maybe can't even handle exercises. Their body's just so keyed up on pain.
Mm-hmm.
With some gentle needles with some stim. I mean, acupuncture is great for this, but we can use those same principles in dry needling to really crank it up another level.
Okay, got it. So would you recommend, or maybe it's going to be condition or patient specific, but would you recommend someone do dry needling and then also get adjusted in the same visit? Would they get adjusted before or after? Or like, what does the intersection with the actual chiropractic adjustment look like when you've got dry needling?
One of my mentors was Burl Pettibon. Burl Pettibon used to had this saying. He had a lot of sayings. One of them was never adjust a cold spine. It was like, look, before they go get adjustment, do whatever you need to do to get it kind of primed and ready for the adjustment, so you get an even better one. And I really took that to heart all through my career. Adjustments are always after some preparation.
Mm-hmm.
And doing dry needling increases circulation to the muscles, reduces the spasm. And even in your patients with osteoarthritis of the cervical spine, if you do periosteopecking on the articular pillars, which I know sounds very invasive, but it works amazingly. It lubricates those joints, and you're going to get motions out of those patients. Those are the patients where you go to adjust them and they get one little click and they're like, thank you so much. Well, after doing dry needling, I've had the same patient, big releases, big mobilizations. It's a great preparatory to the adjustment.
Okay, cool. So here's, without getting I don't expect you to be a walking dictionary of every state, but do you have a overview of, are chiropractors allowed to do dry needling in every state? And like it, I don't know. Can you speak to that a little bit? Because I'm sitting here wondering, could I even do this where I live, for example?
Where do you live, Dr. Stephanie?
I'm in New York State.
Okay, I don't believe you can do it in New York State. And here's the general rule of thumb. If you're on the coasts, probably not.
Okay.
There are states like Florida recently passed legislation to include dry needling in their Practice Act. Texas has it. I believe Louisiana has it. Arizona has it. Nevada has it. And then in the Midwest, they kind of have this. We don't say no and we don't say yes. Yeah, exactly. So you kind of have this. Yeah, so it depends on your state. Some states, there's an hour requirement. Some states, you just have to take a class. Some states, it's like hundreds of hours because they want it to be the same as acupuncture. So it just depends on where you're at. And usually physical therapists, they win that battle, and then we kind of tag along and get to do it as well. So it just depends on your state. Call your state board, call your association. And if you don't have dry needling in your Practice Act, it's something worthwhile to fight for, because your competition definitely is going to have it. Your PTs down the street are going to have it. Your patients already know about it. They ask for it. You can Google it and see the results. It's something that people already know. And I always tell chiropractors, be wary of anything that no other health profession is willing to deal with. If you're the only health profession willing to use a technique or some sort of technology or intervention, it makes me raise an eyebrow. Because with dry needling, I have nurse practitioners in my class. I have physical therapists. I have, everyone's doing it because the evidence is so strong and it's effective. So try to get it done in your state, because it's definitely an asset.
Okay, interesting. So do you know, I don't know if you will know this or not then though, can physical therapists do it? Is it just part of their scope everywhere, or is that going to be state by state too, probably?
Same, state by, and it pretty much it follows chiropractic and PT. Again, they can't, on this coast, it's really, there's just lobbying efforts by the acupuncture profession to try and, maintain their kind of monopoly on providing the technique. Yeah, they want to be in charge of it. Just understand what we do, the same thing with adjustments and other professions. So, we
haven't done a very good job though. I'm just gonna say.
No. Yeah, we won't get into that, but yeah, no.
Different podcast. Different podcast.
That's a whole other podcast. That's an edgier one. That's on the weekends. But yeah, so luckily, because we've teamed up with physical therapists legislatively, that's what's allowed us to kind of move this forward state by state. Chiropractors on their own probably wouldn't have made the victories we would have within dry needling, or made the inroads without the assistance of the APTA.
Okay. Cool. Interesting. I like it. Okay, a little back to clinical. Uh okay, first off, I'm trying to think when I go to acupuncture if they I don't think they do clean the skin first before they put the needles
Oh
in.
boy. Oh man, we're getting into it. All right.
Wait, are they
Uh,
supposed to? Maybe they do. I've never thought of it before. But that's where I was going to ask you. You're talking about how deep these things can go sometimes, cleanliness,
yeah,
infection, like
clean needle technique. Yeah,
yeah.
let's talk about clean needle technique. I think it's important. Um, so clean needle technique, part of these classes is that there are certain requisites that the states require you go over certain things. And one of those things is bloodborne pathogens. And for good
Yeah.
reason. Chiropractors, we're not used to working with bodily fluids or hazardous waste. Well, dry needling kind of changes that. It definitely increases your responsibility to your patients, your staff, and yourself. And so clean needle technique, the best practices, if you look at for like giving injections or using any kind of needle, they'll say you don't have to wear gloves unless you anticipate bleeding. Well, you don't know if somebody's going to bleed or not. Now, the gloves
Yeah.
don't
Yeah.
protect you from a needle stick. They're typically less sterile than your washed hands, but you want to wear them anyway because I want my doctors wearing gloves no matter what. So I just assume do it anyway, right? And you don't know if someone's going to, you pull out a needle, sometimes you're like, oh, we got some blood. What are you going to run over and put on gloves? Just wear the gloves. Alcohol swabs. Again, the recommendation is, look, most of the bacteria lives underneath the surface in the sebaceous glands, and you're driving bacteria into the bloodstream no matter what. So, and the recommendation is that unless it's like soiled or dirty on the outside,
Mhm.
is alcohol necessary? So the answer is, according to the OSHA documents that I've read, the answer is no. That being said, do it anyway.
Mhm.
Alcohol swab every area, put on gloves. It's comforting to the patient. It costs nothing. It shows professionalism. Um, and you don't know what's teeming on the surface. You don't know if that person has a history of MRSA. I mean, how many of our patients come in, give us their history, and they think they only need to tell us the things they think we need to know.
Yeah, always.
Right? You don't know what's going on there. So, be extra safe. It takes it just, again, your physical therapist counterparts are doing it. It's what doctors do. Be a professional, use alcohol, wear gloves, use clean needle technique and proper needle disposal.
Okay, I got a good one. What about like is it always skin on skin or how does that work? Well, it's not
Skin
really
on
it'd be needle on skin, but what do you do about clothes?
Don't ever needle through clothes. I
Okay,
keep
thank
hearing
you.
these horror stories where it's like, oh yeah, they did the needling through their clothes. I'm like, I'm sorry, what? Yeah, that's not okay. Let's just go on the record right now. Not okay. Wear gloves,
Okay,
use
can you
alcohol,
tell us why?
and
I think I have my own ideas, but I'm curious.
yeah, there's bacteria on clothes.
Okay.
Yeah, I mean, you don't know, did that person's dog lay on their lap before you went? It's just don't.
Yeah.
Nobody has anyone given an injection through clothes. Like, let's
Yeah.
be real doctors and let's act accordingly. Draping and gowning. Now, this is a big part of dry needling because you have to expose some parts. It's
Mhm.
important to make sure you have privacy, you have consent, right? You have hopefully somebody else in the room.
Mhm.
That you want to make sure, and you talk your way through that. Oftentimes as chiropractors, we get into a groove. We get into a groove. We're adjusting. We're doing exercise. We're doing soft tissue. We're adjusting. Where it's almost like a short order cook. You're just whipping up fries and then meatloaf and then a burger to go. It's just, I mean, you're in it, and hopefully that's what your office is like. But with dry needling, stakes are too high. You got to
Yeah.
take the moment. You got to slow down. You got to
Mhm.
be focused because there's
Mhm.
increased risk with this. We're not going to pretend like there isn't. There's a risk in pneumothorax, infection, hitting a nerve, hitting a blood vessel, things like that. You want to make sure you are focused on this patient and you are in communication with them. What are you feeling? How are you feeling? Is this okay? Right? If you have to dry needle a piriformis, there's going to be stuff exposed. We don't know what that patient has been through, and it's very important to constantly get consent, talk to them through the process, and make sure that they're having the experience that they want in their healing process with you.
Okay, cool. On that note, what about any negative side effects? I mean, you just mentioned some of the risks. I guess like what are the risks or maybe negative side effects someone might experience?
So the most common at what we call adverse event is bleeding, right? Obviously. Now, most of the times you can avoid blood vessels. It's not the end of the world. They seal up relatively quickly, unless they have some sort of bleeding disorder or they're on some medications, which can result in kind of more bruising. So you can have bruising. Infection is a risk, right? So you want to make sure that we're using clean needle technique. We're not reusing needles, God forbid. What else? Some people faint. It can, if people
Really?
have a history of, yeah, some people just faint. I've had 2 students. Now I've been doing this a long time. I've had 2 students pass out my class. And we have a part in the class to get over the needle phobia, which a lot of chiropractors have. To get over it, we self needle for a minute to try to get used to it. And I've had, and it's not even just, it's not from pain. It's just the idea of
Yep.
a needle's in me, and they just,
Yeah.
and that
Do they get their
happens.
money back or?
No,
I'm
actually,
just
it's so
kidding.
funny. The only no, because they honestly, after they go through it, it's
Then they're
like they wake
fine.
back up. That's it for the rest of it. They're over it.
Yeah.
It happens so fast. And so so there's those kinds of risks. If you have a history of epilepsy, it could induce a seizure. So these are all things we go over in the class.
Interesting.
What kind of risk benefit, also informed consent, let them know what the risks are relative to the benefits so they can make that choice themselves as patients. And also what to do if and when things happen. What if a needle gets stuck? Sometimes the needle doesn't want to come out.
Really?
Yes, it winds around the
Yikes.
fascia and it'll get stuck. Now,
What do you do?
what do you do? You got to come to the class. I'm just kidding. No,
I'm just kidding. I feel like I would start spinning it a little bit and like hope.
the opposite direction. So
I
it
don't know.
winds tight. They get tighter. So as you wind it, it actually gets tighter and it won't come out. And it's great for internal manipulation of the fascia. It works really good.
Yeah.
But then sometimes you'll staff, because in some states your staff can remove them and they'll go, doctor, I can't get this out. You just have to spin it in the opposite direction. Or you can put a needle next to it and the connective tissue will kind of grab to both and you can take them both out. You can contract the antagonist. So there's all sorts of things to do. So we cover all those contingencies in the class.
Wow,
But
I've
you just
never
got
heard of
that part for free.
Yeah, crazy. That had never occurred to me that like they might not come out, at least not as easy as they went in. That's wild.
We do it on every class. I'll wind one up so it gets stuck, and then I'll let everybody try it, and they're like, I really couldn't get this out. Like I can't get this out. And you have to show them how to do it.
Interesting. Yeah. That's crazy. All right,
Yeah.
cool. Okay, let's move on to some more boring component of this. Actually, this is pretty boring. What about like malpractice? Obviously, you would need to disclose to your malpractice insurance company you've added this as a service in your practice. I mean, you've been doing it a long time, so maybe you don't have a good comparison, but is it expensive? Like, does it really increase your premium? Do you have any thoughts on that?
Yeah. I can only speak to my own experience. Every time I've called a malpractice company on this, they've said, if it's already included in your practice act, you're already paying for it.
Okay.
I haven't had one yet that said it's an increase, but I would, no matter anytime you add anything new in your office, man, check with your association, check with your board, and check with your malpractice carrier, just to make absolutely sure.
Yeah.
But that's usually the case. If your state already includes it, you're probably already paying for it.
Got it. That's an interesting way to look at it. Okay, neat. All right. What about documentation, like in terms of charting? Like you obviously need to write that you did something and what do you have to keep track of? Like where they went, what gauge, like what do you have to write down about this?
Yeah. Okay. So, what's funny is dry needling is relatively new in the physical medicine space. And if you know anything about chiropractors and physical therapists, we are the worst documentarians on the planet.
Oh, what do you mean?
And that's not my opinion. That's just Medicare's opinion. We're kissing cousins when it comes to that stuff. So what I did is I'm lucky. I got to work in a multidisciplinary setting with other practitioners. So I get to learn a lot from what they're doing. And one of the things I did was I took their notes from doing a trigger point injection. And then I took the medication part out of it. But the rest of it, it lists, what did you do for the clean needle technique? What percent alcohol did you use? What was the length of the needle? What was the gauge? What was any needling technique? All that stuff. So the nice thing is working with ChiroTouch is I've developed a whole not algorithm, what's it called? Macro set.
Macro.
So that I created a map, that body map with the bubbles on it, and you can click on the muscle that you needled. And then it just asks you, what was the length? What was the gauge? How long did you leave it in? Did you take it out? Did you do pistoning, winding?
Did you send them home with it in? I'm just kidding.
Don't do that. Don't do that. We have a count them in, count them out policy.
Mm.
There's a way to do that. We talk about all those things in our class, and that's one
Yeah.
thing I wanted to add because chiropractors own their own business. Unlike physical therapists, you go to that class, most of them are employees. They have compliance people in their office doing all this for them. But what's your liability if your staff gets stuck with a needle? What things do you have to have in place, and what do you do? What happens if your
Mhm.
staff says, I just was taking needles out and I walked around the corner and so-and-so stabbed me or whatever? Well, now you have an incident. What is your responsibility? And so
Yeah.
all that stuff we talk about in our class about, look, yeah, there's a whole way to deal with that to
Mhm.
minimize your exposure. And so we talk about things like that for sure.
This goes back to the notes a little bit and also
Mhm.
clinically, but how many, I mean, again, it might depend on the patient and what they're seeing you for, but say they're seeing you for like one condition, how many needles might be involved in one session?
I always say do the least amount that you need to do to be effective, especially on that first visit. Needling may not even happen on the first visit. That's
Mhm.
pretty, it's like when you're getting to know someone. It's like you can't just, it's like give it time.
Mhm.
With your patients, you have a relationship, and that is built on trust. I'll start with normally maybe one needle,
Mhm.
just to show them this is how it feels. And also, I want to see how their body responds. People have very odd reactions to needles. Sometimes, even in acupuncture, they'll have emotional, just catharsis for no reason.
Mhm.
Not no reason, but like, it's just unexpected. And you'll ask them, "Are you okay?" They're like, "I feel fine. I just can't stop crying."
Mhm.
Um, or they'll start laughing. They'll get giddy. Something, lots of things can happen. You want to see how to, or they just get really sore, or they're a bruiser. They're bruised like a peach, and you didn't know it. Well, do
Mhm.
one. But you could do as many as, like, for example, I'll do for a piriformis kind of sciatic protocol. That could be, 6 to 8 needles with stim on all of
Okay.
them. Suboccipitals could be 4. Or a contusion to the leg. I deal with a lot of really bad car accidents. So a contusion to the leg might be 30 needles in the bruise with a cup between that and the heart, so you increase circulation. That could be 30 little 15 millimeter needles. So it
Mhm.
really just depends on what you're. I always tell my docs, what are you trying to combat here? Is it neurological pain,
Mhm.
inflammation, increased circulation, range of motion? Once you answer the question of what you want, then you can use the needle to do it.
Got it.
Right? It's like a chef's knife. Are you baking a cake or are you making a steak?
Yeah.
Figure it, then decide what tool you're going to use.
Got it. So then the location of all those needles would have to be documented in your chart note for that day.
Yes, in fact, the coding for dry needling is kind of like adjustments. It's not based on time, which is a huge asset, but it's the first code is 1 to 2 muscles, and the other one is 3 to 4 muscles, or three. I'm sorry, three plus muscles.
Got it.
So you have 2 different levels, and off the top of my head, because I am terrible at remembering codes, I don't remember what those CPT codes are off the top of my head. But you can obviously Google them. But we got those passed through the AMA with the help of the PTs. I forget what year that was, but yeah. So we have coding for this. It's not
Mhm.
time based. You could literally do one needle in and out. It could take 10 seconds, and you've satisfied the code, which is great for personal injury. And we talk about some of those strategies in the class.
Mhm. Got it. Cool. So you've got those macros that you created. Have you shared them with anybody? I don't know if that's anything that you've done yet.
No, they're my precious. No, of course I say or share them
Right?
with as many
No,
people
that's
as
how I
possible.
feel about mine. People are like, I want your macros. I'm like, no,
I've
that'll
worked
be
hard for these.
$500. No, I'm just kidding.
Exactly. No, I share. No, look, my whole thing is I want to, because I teach a lot. I do. I'm a med legal liaison for personal injury. I do a lot of things that aren't seeing patients as much as I used to. So my hope is that my experience and knowledge can then go to other practitioners who then can use it to help their patients. So I'm very big on, if you know something, share something.
Yeah.
Especially in chiropractors, guys, we practice in a bubble where typically we're the smartest person in the room, which, as the saying goes, you're in the wrong room. And
Mhm.
so as chiropractors are pretty isolated. By working in multidisciplinary offices, I learned, man, these guys get smarter and smarter so fast because they're hanging out with a pain management specialist that's double board certified in anesthesiology, with a nurse practitioner who's, she did family practice and now she's doing pain management, PAs and MA, medical assistants. And we're all hanging out together. I learned so much so fast compared to when I was in private practice, that, man, chiropractors have got to get together and they got to start sharing their knowledge and experience with each other, rather than being more, I think, they like to kind of keep it a secret, or
Mm-hmm.
they're just antisocial with each other or competitive, and they
Mm-hmm.
should be working, because really in the end our goal is to see and help as many people as we can. Man, we can do that much better as a team than we can individually.
Yeah, absolutely.
So yes, I share my macros. Absolutely. Long answer.
Yeah. So, and they've helped other people. Like they're easy to understand and they've been able to obviously just utilize. Have you gotten any feedback?
Yes. Yeah. I mean, it saves them hours. I mean, any of you who've sat and built out your own macros,
Many
man,
hours, many hours.
I always say it's like the Constitution. It's a living document. I'm always doing mine, and then I'll find a blip where I'm like, this could be more efficient. And I'll just go in real quick into the
Yeah.
editor. It takes no time. I'm like, this would be a little better if I added this or made this one thing instead of three things.
Mm-hmm.
That's the beauty of ChiroTouch, is on the fly. It's like, do. And then I have a basic sheet that I use that then my staff can use to populate the note, and I can review it. So I want it to be so easy. A high school student could create it based on what I communicate to them. And
Yeah.
now with AI Scribe, man, you can talk to the patient. It creates a synopsis of the visit based on what you said. That is so cool. If I was
Yeah.
seeing in full-time practice, man, that is something I utilize all the time.
Yeah, it's wild. It's almost not creepy, but it's impressive. It's really impressive.
Right.
How well the AI scribe picks things up for sure. I had a funny, totally unrelated but funny story. This patient was here and she was telling me all about how like her back was bothering her and her husband had brought up her fall decorations with all her pumpkins and stuff that she wanted to
Yes.
put around the house, but she was just in so much discomfort. She's like, the Rubbermaid container is just sitting on the kitchen table with the lid on it still. She's like, I haven't even opened it. And so, we've been working with her, but so I went down to edit my note later and I could not believe how it had summarized this long drawn out conversation about her pumpkins that she hasn't put out in her house yet. But like, I'm not going to sit here and type about the pumpkins, right? But like the AI scribe was able to capture like the essence of that story and just
Yeah.
like in one sentence, very clearly explain like, I forget what it said, something about her seasonal decorations or something, but, I mean, I laugh. I literally laugh, and it's made charting kind of fun. And like, I can't wait to see what it writes. Usually, like, I'll be with a patient, and I'm like, oh, I can't wait to see what it's going to say about this. So, no,
Yeah.
definitely a game changer. I don't know how much you've really used it, but do you feel like you're using the scribe as well as the macros, or?
You know, I use pretty much the macros. I
Mhm.
keep my stuff so simple.
Yeah.
And also what I do, a lot of telehealth with personal injuries. So like I'll just interview people over chat,
Hmm.
and then decide where they need to go and help manage their cases. I practice in a totally different and unique way, but I'm also a one-man show, meaning when I don't have staff. So
Hmm.
I see we had over 1,000 referrals in the last year and a half into my company. And, I have to do everything on my own. So
Yeah.
some of these, I end up having to do the intakes and everything like that. So, and I do not like redundancy. So I'm a
Hmm.
big fan of that intake is so good at getting the information that you need.
Yeah.
And then if you wanted to create a narrative out of it, that's a click of a button.
Yeah.
And then from there, it's super easy. So, but I could see how especially let's say somebody just pops in, man, and you're like, I don't have time to get their paperwork. I don't have time.
Yeah.
I would see how I would just love to click on that scribe, be like, all right, let's talk about your health history. Let's talk about this. And you're not worried about trying to type simultaneously while also trying to be present with the patient. There's
Hmm.
nothing worse than a doctor typing and dealing with their computer while you're trying to explain to them your situation,
Yeah.
right? So it's it allows you to be present, which I think is, and that's the rewarding part of being a doctor, being present in the moment with your patient. We didn't get into this to be typing notes all day. We got into it because we love people, which is probably why we don't like doing notes, and why I love ChiroTouch, because it allows you to do more of the doctor stuff that makes you happy and less of the admin stuff that, we became
Makes you less
chiropractors to
happy.
avoid.
Yeah,
Yeah.
exactly. Yeah, I had to actually went to see my medical doctor this past week, and it was hilarious because I know that they had migrated over to like a new charting system in their office a year or two ago, and it was actually one of my patients was like their liaison for the company to like do this or whatever. But so I'm in there Friday, day and I'm just looking at her because she like comes in with her laptop and it rolls in. She's got this little table. And then, and she's listening, and I felt like she was present for the most part, but like she was typing the entire time. And I was just thinking to myself, like, you guys don't have there's no AI scribe listening to us right now.
Right.
So it's amazing. I mean, I've only had it in my practice for a few months, but it's amazing to me how, like, I almost have this expectation now that like all of my healthcare providers should be using it because I have it.
Right.
But I also was kind of like, wow, how do you not have this technology helping us in our visit today? Like, I was surprised. It was
Well,
weird. I'm actually going to ask when I go next. I suspect that she'll say, they can only implement so many things at a time, which is kind of true. But anyways. So
yeah.
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 All
For sure.
right. So, oh, sorry. Were you going to say something?
I was going to say in pain management, they have a scribe. It's called a person. They walk around with a cart,
Yeah.
and they're clicking away while the doctor's talking and doing their thing. And it's horribly inefficient. And so, having this technology and, the plus side of being a chiropractic office is that you can change things on the fly like that. Healthcare in general, when you're working in medical practice, it's too big of a ship to make quick turns. And so when those kinds of integrations are harder to do. And the nice thing about being a chiropractor and having ChiroTouch, it's the click of a few buttons. Getting in touch with somebody to help that you could change a policy or procedure using ChiroTouch over lunch.
Yeah.
And make your practice better. You see something wrong, you immediately can change it with ChiroTouch, and your practice is better immediately after lunch.
It really can be that fast. So we're definitely fortunate in that regard for sure.
Yeah.
All right. We touched on this a little bit before, but certainly like you guys have your own courses and classes, but like what's typical training that might be involved for somebody that wanted to maybe get certified in dry needling, or what does that look like?
Okay. So every state is different.
Mm-hmm.
My classes, because first I did it kind of like when I went to the physical therapy classes, who I want to give huge credit to Sue Falsone in structure and function dry needling. I was one of the few chiropractors in her class, and she took me under her wing. And she was the first female trainer in MLB history for the Dodgers. I learned she was so generous with her time and experience to do this for me, or to bring me under her wing and educate me in dry needling. I TA'd for her, and that's kind of how I learned how to do all this so fast. But the classes were split up into like, advanced or upper extremity, lower extremity. Well, that makes sense for a physical therapist, right? Because it's a lot of extremities, and the spine is also there. Ours is more focused spine and then extremities. And so I've split my classes up into spine and extremity. So there's a whole weekend of spine and there's a whole weekend of extremity. And I address it based on condition specific, meaning when they come in, this is what I have as far as the literature on how to use dry needling, integrate it with what you already know, and then on how to treat specific things like plantar fasciitis protocol, migraine protocol, TMJ, sciatica, so it's organized more for chiropractors. Whereas if you go to a lot of these other classes, you're going to get upper extremity and maybe cervical and thoracic, right? And that's going to be a 2 to 3 day class over the course of 24 hours or so. In mine, we do it in 2 days. And we also integrate a lot of the rehab, meaning, okay, what kind of exercises should we do with this? I mean, you've adjusted someone, you've needled someone, you now produce this motion. What are you going to do with it? How do we make this stick? And that's I think we keep dropping the ball as chiropractors, is we got to get into active, care. What the patient's part of the responsibility of the care. We get them moving, but it's their job to keep it moving. So increase mobilization, mobility, increase stability and strength. And then how do we move someone along that program? And I think a lot of times we try to farm it out. I think sometimes chiropractors go, well, here's a brochure on some exercises. Physical therapist's office, you go to their office, it's a big open space with rubber bands and balls. It looks like Cirque du Soleil. Chiropractic offices, I find a lot of times when I go to them, I call it like a flop house. It's just people laying on tables, getting stuff done to them. It's a roller table and then some stim over here and the heat pack. And they're just laying there going, does it feel better yet? Does it feel better yet? We're going to well, if it doesn't, then we kind of go, well, you got to give it time. That's unacceptable.
Mm-hmm.
People need to get moving and keep moving. And we know the literature is just passive modalities do not work as well as active care. The quicker you get them moving and doing stuff, the better they're going to be. So we teach a lot of that in the class of, hey, you got them moving. This is the quickest, best way to get them moving is needles and adjustment. What are you going to do with that? Because as we know, look, let's just be frank. Chiropractic incomes have not gone up in over 30 years.
Mm-hmm.
Insurance companies are not going to wake up one day and decide to start paying us more. Okay. The median income of a chiropractor, I think right now, according to the Bureau of Labor Statistics, is what, $60,000, whereas a PT is $80,000. Let's be frank. And as soon as they get prescribing rights, we're going to be up a creek.
Mm-hmm.
So you better get real efficient at solving the problems your patients want you to solve quickly, because they're not coming in 3 times a week anymore. I don't even leave the house to go get toilet paper. Okay, I don't like grocery shopping. Everything is
I don't
now.
like going anywhere either.
No, so you better be able to fix people in 2 visits a week and do it fast. And that means, and as incomes go down, which has always been the case for chiropractors. My father's a chiropractor in Mercedes 80s. They haven't come back. They're never coming back. So get efficient, and that's where ChiroTouch is great, because it makes you super efficient at managing your practice. But needles don't cost much, adjustments work great, and exercise doesn't cost much either. Those are the 3 things that are the most effective in dealing in joint pain management, and they don't cost a lot. We got to get fast, cheap, and effective. And that's actually what they're saying at the physical therapist classes that I sit in now. Same thing. They're like, look, guys, reimbursements are going down. All these techs and big spaces and equipment, it's all going away. So you guys better get real consumerist real quick. So when patients come in, they say, I have this pain. You better be able to fix it. Mm-hmm. And this thing where your real problem is actually this, the bait and switch chiropractic, not going to fly anymore. So you better get real good at fixing the problem they walk in with super fast and super efficiently.
Yeah, for sure. So you have a website and you have courses and trainings. Can people host those, or do you have set places where you are teaching, or how do you like to organize that?
Yeah. So right now I'm teaching in Phoenix, Austin, Dallas, and Houston. That being said, I'm always looking for other states to come to, and especially as their practice sets. And usually it works like this: is an association will call me or a practitioner and say, hey, I want to host a class. So first we're going to find out, well, can we do this there? As soon as we find out that we can, then it's like, all right, and we try to bring a class there, and if it works, we'll keep coming there. So we're looking at states like North Carolina, Florida, Minnesota, or I'm sorry, Montana. Trying to see where we can go to do these courses. And so we're real open. So my website's chironeedle.com. You can see what classes we have going on right now. And then if you want one to come to your area, let's say you have a group of docs already and you're like, we want to know dry needling, will you please come here? I'm more than happy to do that.
Okay.
I want chiropractors to have this tool. I want them to be competitive, and I want them to be effective in the future coming ahead.
Awesome. I like it. Yeah. So we're going to have a link to your site in the description of the podcast. So whoever is listening, if you guys just pop open that description, you can find that link there to get to Dr. Wiegand's website. And last question, unless you have more to add, of course, but if there were someone on the fence, like, should I do this? Should I not? Like, it's going to be too hard or too much, or it's like, I'm so busy in practice right now. It's just one more thing to add to everybody's plate. Like, what advice or how would you respond to that if somebody was on the fence?
Well, I'd say one, you take the class, even if you don't know if you want to do it, because then you can decide whether the best way to know whether you want to do it or not is to go do it and see if it's for you. And then, our age ranges in our class are from people who graduated a week ago to 70-year-old practitioners. Again, my father is I'm a second generation chiropractor, and his 70-year-old friends are in my class often. So you're never, as a doctor, here's something you never want to hear as a doctor. I've had doctors who say, well, I've been doing paper handwritten notes for 25 years and it's been fine. I never want to hear any doctor say that. My dentist said, this is why I've been doing it for 25 years and I'm not changing. That's not what you want to hear out of doctors. Mm-hmm. There is no place for traditionalism within healthcare. There just isn't. So if you're a chiropractor, if you want to expand your knowledge and actually gain a new skill, which again is super rare out there, This is the class. And if you don't want to take mine, that's fine. There are great other ones. I love, again, structure and function dry needling with Sue Falsone. If you're a sports person and you want to do that kind of thing, she is amazing. If you want to do more like pain management, chiropractic, and rehab, that's my class. It's what I designed it for. Go out there, and there's a million different ways to do it. It's almost like adjusting. There's nothing more fun than learning how to adjust and then doing it and getting better and better. Mm-hmm. But everything else we do in our practice is buying a machine. Typically, it does stuff to people, and we become technicians.
Yeah.
Well, good news. Dry needling is like adjusting. It's that much fun. It's like having another adjusting tool where you get to become the artist again. I always say, be a chef, not a cook. Write the recipes, don't follow them.
I like it. Nice. Well, Dr. Wiegand, thank you so much for joining us and sharing your knowledge today. It's really clear that dry needling is probably, I don't want to say probably going to become mainstream because I already think it's super prevalent, but I do think that it is very up and coming, and we're just going to start seeing more and more of it. So it's probably a good idea for chiropractors to try to help be on the forefront of that for sure. And I do think it can complement, what we're already doing with chiropractic care in our offices. So for our listeners, if you want to check out Dr. Wiegand's pre-built dry needling macros for ChiroTouch or learn more about a course with ChiroNeedling, we have added links into today's episode notes. And don't forget to like, subscribe, and share ChiroCast with a colleague who would benefit from today's conversation. Thanks for listening as always, and we'll talk soon. Thank you.
Thank you for joining us on this episode of ChiroCast, Insights for Modern Chiropractors, brought to you by ChiroTouch. Hosted by Dr. Stephanie Brown, produced by Debbie Brooks, editing from Matthew Dodge, and title animation by Eric Madden. Our theme song, House 5, is from Scott W. Brooks. If you enjoyed today's show, don't forget to like, link, and subscribe. We appreciate your support, and we'll catch you next time.